Psychiatric Q&A Part 6. 151. A client with anorexia nervosa describes herself as a whale. However, the nurse's assessment reveals that the client is 5 feet 8 inches, 1.7 meters, tall and weighs only 90 pounds, 40.8 kilograms. Considering the client's unrealistic body image, which intervention should be included in the plan of care? A. Asking the client to compare her figure with magazine photographs of women her age. B. Assigning the client to group therapy, in which participants provide realistic feedback about her weight. C. Confronting the client about her actual appearance during one-on-one sessions, scheduled during each shift. D. Telling the client of the nurse's concern for her health and desire to help her make decisions to keep her healthy. The answer is D. Telling the client of the nurse's concern for her health and desire to help her make decisions to keep her healthy. Rationale: a client with anorexia nervosa has an unrealistic body image that causes consumption of little or no food. Therefore, the client needs assistance with making decisions about health. Instead of protecting the client's health, options A, B, and C may serve to make the client defensive and more entrenched in her unrealistic body image. 152. In the emergency department, a client with facial lacerations states that her husband beat her with a shoe. After the healthcare team repairs her lacerations, she waits to be seen by the crisis intake nurse, who will evaluate the continued threat of violence. Suddenly the client's husband arrives, shouting that he wants to finish the job. What is the first priority of the healthcare worker who witnesses this scene? A. Remaining with the client and staying calm. B. Calling a security guard and another staff member for assistance. C. Telling the client's husband that he must leave at once. D. Determining why the husband feels so angry. The answer is B. Calling a security guard and another staff member for assistance. Rationale: the healthcare worker who witnesses this scene must take precautions to ensure personal as well as client safety, but shouldn't attempt to manage a physically aggressive person alone. Therefore, the first priority is to call a security guard and another staff member. After doing this, the healthcare worker should inform the husband what is expected, speaking in concise statements and maintaining a firm but calm demeanor. This approach makes it clear that the healthcare worker is in control and may diffuse the situation until the security guard arrives. Telling the husband to leave would probably be ineffective because of his agitated and irrational state. Exploring his anger doesn't take precedence over safeguarding the client and staff. 153. A client with disorganized type schizophrenia has been hospitalized for the past 2 years in a unit for chronic mentally ill clients. The client's behavior is labile and fluctuates from childishness and incoherence to loud yelling to slow but appropriate interaction. The client needs assistance with all activities of daily living. Which behavior is characteristic of disorganized type schizophrenia? A. Extreme social impairment. B. Suspicious delusions. C. Waxy flexibility. D. Elevated affect. The answer is A. Extreme social impairment. Rationale: disorganized type schizophrenia, formerly called hebephrenia, is characterized by extreme social impairment, marked inappropriate affect, silliness, grimacing, posturing, and fragmented delusions and hallucinations. A client with a paranoid disorder typically exhibits suspicious delusions, such as a belief that evil forces are after him. Waxy flexibility, a condition in which the client's limbs remain fixed in uncomfortable positions for long periods, characterizes catatonic schizophrenia. Elevated affect is associated with schizoaffective disorder. 154. A client is admitted for an overdose of amphetamines. When assessing this client, the nurse should expect to see A. Tension and irritability. B. Slow pulse. C. Hypotension. D. Constipation. The answer is A. Tension and irritability. Rationale: an amphetamine is a nervous system stimulant that is subject to abuse because of its ability to produce wakefulness and euphoria. An overdose increases tension and irritability. Options B and C are incorrect because amphetamines stimulate norepinephrine, which increases the heart rate and blood flow. Diarrhea is a common adverse effect, so option D is incorrect. 155. After completing chemical detoxification and a 12-step program to treat crack addiction, a client is being prepared for discharge. Which remark by the client indicates a realistic view of the future? A. I'm never going to use crack again. B. I know what I have to do. I have to limit my crack use. C. I'm going to take one day at a time. I'm not making any promises. D. I will substitute crack for something else. The answer is C. I'm going to take one day at a time. I'm not making any promises. Rationale: 12-step programs focus on recovery one day at a time. Such programs discourage people from claiming that they will never again use a substance, because relapse is common. The belief that one may use a limited amount of an abused substance indicates denial. Substituting one abused substance for another predisposes the client to cross-addiction. 156. The nurse is caring for a client being treated for alcoholism. Before initiating therapy with disulfiram antabuse, the nurse teaches the client that he must read labels carefully on which of the following products? A. Carbonated beverages. B. Aftershave lotion. C. Toothpaste. D. Cheese. The answer is B. Aftershave lotion. Rationale: disulfiram may be given to clients with chronic alcohol abuse who wish to curb impulse drinking. Disulfiram works by blocking the oxidation of alcohol, inhibiting the conversion of acetaldehyde to acetate. As acetaldehyde builds up in the blood, the client experiences noxious and uncomfortable symptoms. Even alcohol rubbed onto the skin can produce a reaction. The client receiving disulfiram must be taught to read ingredient labels carefully to avoid products containing alcohol such as aftershave lotions. Carbonated beverages, toothpaste, and cheese don't contain alcohol and don't need to be avoided by the client. 157. Which of the following drugs may be abused because of tolerance and physiologic dependence? A. Lithium, Lithobid, and D. Valproex, Depakote. B. Verapamil, Calin, and chlorpromazine, Thorazine. C. Alprazolam, Xanax, and phenobarbital, Luminal. D. Clozapine, Clozaril, and amitriptyline, Elavil. The answer is C. Alprazolam, Xanax, and phenobarbital, Luminal. Rationale: both benzodiazepines, such as alprazolam, and barbiturates, such as phenobarbital, are addictive, controlled substances. All the other drugs listed aren't addictive substances. 158. A client is hospitalized with fractures of the right femur and right humerus sustained in a motorcycle accident. Police suspect the client was intoxicated at the time of the accident. Laboratory tests reveal a blood alcohol level of 0.2%, 200 mg per dl. The client later admits to drinking heavily for years. During hospitalization, the client periodically complains of tingling and numbness in the hands and feet. The nurse realizes that these symptoms probably result from A. Acetate accumulation. B. Thiamine deficiency. C. Triglyceride buildup. D. A below normal serum potassium level. The answer is B. Thiamine deficiency. Rationale: numbness and tingling in the hands and feet are symptoms of peripheral polyneuritis, which results from inadequate intake of vitamin B1, thiamine, secondary to prolonged and excessive alcohol intake. Treatment includes reducing alcohol intake, correcting nutritional deficiencies through diet and vitamin supplements, and preventing such residual disabilities as foot and wrist drop. Acetate accumulation, triglyceride buildup, and a below normal serum potassium level are unrelated to the client's symptoms. 159. A dystonic reaction can be caused by which of the following medications? A. Diazepam, Valium. B. Haloperidol, Haldol. C. Amitriptyline, Elavil. D. Clonazepam, Klonopin. The answer is B. Haloperidol, Haldol. Rationale: haloperidol is a phenothiazine and is capable of causing dystonic reactions. Diazepam and clonazepam are benzodiazepines, and amitriptyline is a tricyclic antidepressant. Benzodiazepines don't cause dystonic reactions, however, they can cause drowsiness, lethargy, and hypotension. Tricyclic antidepressants rarely cause severe dystonic reactions, however, they can cause a decreased level of consciousness, tachycardia, dry mouth, and dilated pupils. 160. The nurse is caring for a client with bulimia. Strict management of dietary intake is necessary. Which intervention is also important? A. Fill out the client's menu and make sure she eats at least half of what is on her tray. B. Let the client eat her meals in private. Then engage her in social activities for at least 2 hours after each meal. C. Let the client choose her own food. If she eats everything she orders, then stay with her for 1 hour after each meal. D. Let the client eat food brought in by the family if she chooses, but she should keep a strict calorie count. The answer is C. Let the client choose her own food. If she eats everything she orders, then stay with her for 1 hour after each meal. Rationale: allowing the client to select her own food from the menu will help her feel some sense of control. She must then eat 100% of what she selected. Remaining with the client for at least 1 hour after eating will prevent purging. Bulimic clients should only be allowed to eat food provided by the dietary department. 161. A client who's at high risk for suicide needs close supervision. To best ensure the client's safety, the nurse should: A. Check the client frequently at irregular intervals throughout the night. B. Reassure the client that the nurse will hold in confidence anything the client says. C. Repeatedly discuss previous suicide attempts with the client. D. Disregard decreased communication by the client because this is common in suicidal clients. A. Check the client frequently at irregular intervals throughout the night. Rationale: checking the client frequently but at irregular intervals prevents the client from predicting when observation will take place and altering behavior in a misleading way at these times. Option B may encourage the client to try to manipulate the nurse or seek attention for having a secret suicide plan. Option C may reinforce suicidal ideas. Decreased communication is a sign of withdrawal that may indicate the client has decided to commit suicide. The nurse shouldn't disregard it. Option D. 162. While pacing in the hall, a client with paranoid schizophrenia runs to the nurse and says, "Why are you poisoning me? I know you work for Central Thought Control. You can keep my thoughts. Give me back my soul." How should the nurse respond during the early stage of the therapeutic process? A. I'm a nurse. I'm not poisoning you. It's against the nursing code of ethics. B. I'm a nurse, and you're a client in the hospital. I'm not going to harm you. C. I'm not poisoning you. And how could I possibly steal your soul? D. I sense anger. Are you feeling angry today? B. I'm a nurse, and you're a client in the hospital. I'm not going to harm you. Rationale: the nurse should directly orient a delusional client to reality, especially to place and person. Options A and C may encourage further delusions by denying poisoning and offering information related to the delusion. Validating the client's feelings, as in option D, occurs during a later stage in the therapeutic process. 163. A nurse is caring to a client with manic disorder in the psychiatric ward. On the morning shift, the nurse is talking with the client who is now exhibiting a manic episode with flight of ideas. The nurse primarily needs to A. Focus on the feelings conveyed rather than the thoughts expressed. B. Speak loudly and rapidly to keep the client's attention, because the client is easily distracted. C. Allow the client to talk freely. D. Encourage the client to complete one thought at a time. The answer is B. Speak loudly and rapidly to keep the client's attention, because the client. Often the verbalized ideas are jumbled, but the underlying feelings are discernible and must be acknowledged. 164. A depressed client is on an MAO inhibitor? What should the nurse watch out for? A. Hypertensive crisis. B. Diet restrictions. C. Taking medication with meals. D. Exposure to sunlight. The answer is A. Hypertensive crisis. This is the more inclusive answer, although diet restrictions, answer 1, are important, their purpose is to prevent hypertensive crisis, answer 2. 165. A 20-year-old female client is diagnosed with anxiety disorder. The physician prescribed fluoxetine, Prozac. What is the most important side effects should a nurse be concerned? A tremor, drowsiness. B. Seizures, suicidal tendencies. C. Visual disturbance, headache. D. Excessive diaphoresis, diarrhea. The answer is B. Seizures, suicidal tendencies. Assess for suicidal tendencies, especially during early therapy. There is an increased risk of seizures in debilitated client and those with a history of seizures. 166. The nurse suspects that the client is suffering from depression. During assessment, what are the most characteristic signs and symptoms of depression the nurse would note? A. Constipation, increased appetite. B. Anorexia, insomnia. C. Diarrhea, anger. D. Verbosity, increased social interaction. The answer is B. Anorexia, insomnia. The appetite is diminished and sleeping is affected to a client with depression. 167. A 16-year-old girl is admitted for treatment of a fracture. The client shares to the nurse caring to her that her stepfather has made sexual advances to her. She got the chance to tell it to her mother but refuses to believe. What is the most therapeutic action of the nurse would be? A. Tell the client to work it out with her father. B. Tell the client to discuss it with her mother. C. Ask the father about it. D. Ask the mother what she thinks. The answer is D. Ask the mother what she thinks. This comes closest to beginning to focus on family-centered approach to intervene in the conspiracy of silence. This is therefore the best among the options. 168. A young lady with a diagnosis of schizophrenic reaction is admitted to the psychiatric unit. In the past 2 months, the client has poor appetite, experienced difficulty in sleeping, was mute for long periods of time, just stayed in her room, grinning and pointing at things. What would be the initial nursing action on admitting the client to the unit? A. Assure the client that you will be well cared for. B. Introduce the client to some of the other clients. C. Ask, do you know where you are? D. Take the client to the assigned room. The answer is D. Take the client to the assigned room. The client needs basic, simple orientation that directly relates to the here and now, and does not require verbal interaction. 169. On an adolescent unit, a nurse caring to a client was informed that her client's closest roommate dies at night. What would be the most appropriate nursing action? A. Do not bring it up unless the client asks. B. Tell the client that her roommate went home. C. Tell the client, if asked, you should ask the doctor. D. Tell the client that her closest roommate died. The answer is A. Do not bring it up unless the client asks. The nurse needs to wait and see, do not jump the gun, do not assume that the client wants to know now. 170. A 30-year-old married woman comes to the hospital for treatment of fractures. The woman tells the nurse that she was physically abused by her husband. The woman receives a call from her husband telling her to get home and things will be different. He felt sorry of what he did. What can the nurse advise her? A. Do you think so? B. It's not likely. C. What will be different? D. I hope so, for your sake. The answer is C. What will be different? This option helps the woman to think through and elaborate on her own thoughts and prognosis. 171. A female client was diagnosed with breast cancer. It is found to be stage 4, and a modified mastectomy is performed. After the procedure, what behaviors could the nurse expect the client to display? A. Denial of the possibility of carcinoma. B. Signs of grief reaction. C. Relief that the operation is over. D. Signs of deep depression. The answer is B. Signs of grief reaction. It is mostly likely that grief would be expressed because of object loss. 172. A nurse is assigned to activate a client who is withdrawn, hears voices and negativistic. What would be the best nursing approach? A. Mention that the voices would want the client to participate. B. Demand that the client must join a group activity. C. Give the client a long explanation of the benefits of activity. D. Tell the client that the nurse needs a partner for an activity. The answer is D. Tell the client that the nurse needs a partner for an activity. The nurse helps to activate by doing something with the client. 173. The nurse is caring to an autistic child. Which of the following play behavior would the nurse expect to see in a child? A. Competitive play. B. Nonverbal play. C. Cooperative play. D. Solitary play. The answer is D. Solitary play. Autistic children do best with solitary play because they typically do not interact with others in a socially comprehensible and acceptable way. 174. The nurse is interacting to a client with an antisocial personality disorder. What would be the most therapeutic approach of the nurse to an antisocial behavior? A. Gratify the client's inner needs. B. Give the client opportunities to test reality. C. Provide external controls. D. Reinforce the client's self-concept. The answer is C. Provide external controls. Personality disorders stem from a weak superego, implying a lack of adequate controls. 175. A client with dementia is for discharge. The nurse is providing a discharge instruction to the family member regarding safety measures at home. What suggestion can the nurse make to the family members? A. Avoid stairs without banisters. B. Use restraints while the client is in bed to keep him or her from wandering off during the night. C. Use restraints while the client is sitting in a chair to keep him or her from wandering off during the day. D. Provide a night light and a big clock. The answer is D. Provide a night light and a big clock. This option is best to decrease confusion and disorientation to place and time. 176. A 55-year-old male client tells the nurse that he needs his glasses and hearing aid with him in the recovery room after the surgery, or he will be upset for not granting his request. What is the appropriate nursing response? A. Do you get upset and confused often? B. You won't need your glasses or hearing aid. The nurses will take care of you. C. I understand. You will be able to cooperate best if you know what is going on, so I will find out how I can arrange to have your glasses and hearing aid available to you in the recovery room. D. I understand you might be more cooperative if you have your aid and glasses, but that is just not possible. Rules, you know. The answer is C. I understand. You will be able to cooperate best if you know what is going on, so I will find out how I can arrange to have your glasses and hearing aid available to you in the recovery room. The client will be easier to care for if he has his hearing aid and glasses. 177. A male client is repetitively doing the hand washing every time he touches things. It is important for a nurse to understand that the client's behavior is probably an attempt to A. Seek attention from the staff. B. Control unacceptable impulses or feelings. C. Do what the voices the patient hears tell him or her to do. D. Punish himself or herself for guilt feeling. The answer is B. Control unacceptable impulses or feelings. A ritual, such as compulsive hand washing, is an attempt to allay anxiety caused by unconscious impulses that are frightening. 178. In a mental health settings, the basic goal of nursing is to advance the science of psychiatry by initiating research and gathering data for current statistics on emotional illness. B. Plan activity programs for clients. C. Understand various types of family therapy and psychological tests and how to interpret them. D. Maintain a therapeutic environment. The answer is D. Maintain a therapeutic environment. This is the most neutral answer by process of elimination. 179. A female client tells the nurse that she is afraid to go out from her room because she thinks that the other client might kill her. The nurse is aware that this behavior is related to A. Hallucination. B. Ideas of reference. C. Delusion of persecution. D. Illusion. The answer is C. Delusion of persecution. The client has ideas that someone is out to kill her. 180. Which of the following nursing approach is most important in a client with depression? A. De-emphasizing preoccupation with elimination, nourishment, and sleep. B. Protecting against harm to others. C. Providing motor outlets for aggressive, hostile feelings. D. Reducing interpersonal contacts. The answer is C. Providing motor outlets for aggressive, hostile feelings. It is important to externalize the anger away from self.